go. So we're recording now, so that's good. So, and people are still coming in, so that's great. So I want to just give you a brief overview of testosterone. If you have any questions, this is a great place to ask. I love testosterone. It's one of my favorite hormones for men, but also for women. I find that even before menopause, women can use testosterone. I find it to be really helpful for a number of things, and we're going to be going over that. Testosterone has the same effects on men and women, so it's just that women take a much lower dose. One of the books that I like is this Testosterone for Life, and it's by Dr. Morgentaler, Abraham Morgentaler. He's from Harvard, and he practices in Massachusetts, my home state, and he's an excellent writer. I think I have another book that I read of his, but he's one of the prime researchers on testosterone therapy, and he's been doing it for a number of years. And I really recommend, I think he's, definitely trustworthy. That's always the biggest thing. Like, what are people saying? And do I trust this information? And I trust his work a lot. And a lot of the courses that I go to quote him and from the research study. So testosterone can be really important. So let's see if I can. So there's all different types of hormones. So there's estrogen, progesterone, testosterone, DHEA, thyroid, insulin. There's more, there's pregnenolone. So there's other hormones as well. But the main thing is what I love about hormones is they really help us live a productive life. They help us feel better. They're good for longevity. They definitely help metabolism, and they help libido. A lot of people think, so John's asking, how can I lower my volume? I guess there's a volume page there. And you guys can, there is a chat, but also libido. And oftentimes when people think of testosterone, that's the first thing they think of is, sex, or libido and sexual function. And so, but there are so many more benefits to it. And, I love the fact that it does help libido, but there's so many more effects that happen in both men and women. So I just want to just kind of increase your awareness of that. And so there are age-related hormone changes, and there are many health issues with all the different hormones. And so men also have estrogen. Men have some progesterone. Really, I don't give progesterone to men, but DHEA as well. So there's a lot of different hormones. And as we get older, the hormones will decrease. And when hormones decrease, then our health also decreases. And so if we optimize our hormones, we can optimize our health. And so testosterone itself is secreted by ovaries, adrenals, the testicles, and it is really one of the fastest growing areas in medicine for both men and women. And I'm sure you've seen a number of testosterone ads, whether it be on TV or in the paper, boost your sexual function. And it used to be, years and years ago, low, like erectile dysfunction was considered more of a mental problem until, Viagra came out. And then they realized, and the more research, and Dr. Morgentaler was involved in a lot of the research on the physical sides of low T. So or erectile dysfunction. It's not necessarily, just all in your head, which they used to think that. And so when they started to do more research and they found that there is more of a physical problem, then the drugs started getting made. But there are some natural, and I don't really think of testosterone as a drug, although it is an FDA drug that needs to be, certain class of drugs that needs a doctor's prescription. You can't get it over the counter or anything, but it can be very helpful. So longevity, metabolism, and libido. So good. So there are people still coming in. All right. So testosterone has many effects on the body. And so it affects our brain. It affects, of course, sexual function. It's also very good for the muscles. And it's good for fat, so fat loss. And it's also very good for bone health. And so we can talk about all these different things, but testosterone will help with lean body mass. And that's one of the things, you think of strength and stamina. Testosterone is very good for that. It also has a lot of protective benefits. So testosterone does help protect against cardiovascular disease. So it's very good for the heart. And so oftentimes, when women go through menopause, the loss of estrogen, the risk of heart disease goes up by 50%. Well, when testosterone goes down, the risk of heart disease also goes up. I haven't seen a number like how much, but it's also due to the loss, because testosterone does convert into estrogen in men as well. And so just the loss of testosterone decreases the loss of estrogen, which also causes the increased heart disease. It also helps protect against diabetes. So most men and women that have diabetes have low T. So most overweight men have low testosterone and higher insulin resistance. And they found that testosterone replacement can help with weight loss. And so weight gain. So when you lose testosterone, same with women, when you lose estrogen, we tend to gain weight later in life. And that's why, is because it affects the insulin sensitivity. Hypertension, so blood pressure will go up. And that has to do with probably the insulin sensitivity, because as your insulin goes up, that affects your blood pressure. Bone health, so osteoporosis, hormones, osteoporosis and bone loss is not a calcium problem. I really don't prescribe calcium to my patients very often because the hormones, and of course vitamin D, which helps regulate the calcium into the bone, is very important. Arthritis goes up as we age. So as the hormones go down, arthritis goes up. And that's one of the main ways I got into hormones, is because I do a lot of joint pain, back pain. I'm a physical therapist in my previous life, it's still part of me, but so I do a lot of physical medicine and joint pain. And that's what got me into hormones. And I noticed when people had their hormones optimized, that their pain levels reduced and they healed faster from the treatments that I gave them. Memory conditions. So as we get older, we tend to forget more, or, Alzheimer's and dementia become more and more prevalent. And the studies show that testosterone also helps with that. So as you can see, there's a ton of benefits to taking testosterone. So here it is. So it affects the brain and mood. I thought that was so important. Helps prevent Alzheimer's disease and dementia. It also helps with depression. So this is key for me. So in another book that I have, it's called Hormone Replacement, The Answers. I love this book. It's really, testosterone this, estrogen this, all the different hormones. But one of my favorite things about testosterone, it does help mood. And so oftentimes people will feel, just better mood in general from taking testosterone. So, and it also helps with inflammation. So as our,
open it and see.
okay. So it helps with reducing inflammation, helps our memory, and again, with libido and sexual performance. Okay. So testosterone, people often think of it with sexual issues. So if you, there's a question, Adam, someone has their volume, but the Adam questionnaire talks about like low T for, men in particular. A lot of the testosterone studies are on men, although there are studies on women too, but most of the, the levels are so much higher in men, but low sex drive is one of the main things. So if someone comes in, they have a low libido, the first hormone I think of, there are other things that go with it, is sex drive. A lot of times people are men with erectile dysfunction, even women with difficulty with orgasms can have low T. Often that's one of the first signs. And that's Dr. Morgenthaler did a ton of research on erectile dysfunction, doing, putting electrodes on the penis, and checking blood flow and all these different things. And that they found is that when they supplemented the testosterone, that a lot of the physical attributes of why they had erectile dysfunction went away. And sometimes it takes longer for men to have an orgasm. That's usually due to low T, as well as reduced fluids that get ejaculated. So again, non-sexual symptoms is low energy. People have more fatigue. I had a guy the other day talking to me. He's remodeling his home, and he just doesn't have the energy to do it as much. And we supplemented the testosterone, and he feels back that he can keep going. He's not as tired as he was. He feels more strong. He's able to do the work he needs to do. So if, weight gain is very common. Again, just helping with getting back someone's mojo. And he, this particular fellow, he was like, he's been married for a long time, and he's chasing his wife around the house again. They're having fun with it, so it is kind of fun to hear the nice stories that they share.
Nice.
So, and then testosterone is very important for building muscle mass. Muscle strength and stamina is one of the key features. And so if people are complaining of, just not being able to, for example, like a bodybuilder, not being able to lift the weight that they were able to, or one of my patients is a bicycle racer, and he feels fine. So we're not supplementing at this time, but that, if he was feeling loss of ability to race or something, then we might consider something like that. And again, the brain function and the mood. So just enhanced well-being, the mental sharpness, if you're feeling forgetful, more often than not. Sometimes people complain of mental slowness, just not thinking as quickly, can be a symptom. And so, just, want to make sure that people understand it's also a very good hormone for women. So with men, I'll prescribe like 100 to 200 milligrams a week if it's an injection. And then for women, we usually use creams, but the dose is like 1 milligram, 2 milligrams. So it's much less of a dose, but it can go up to, I've heard people taking 10 milligrams. So, but again, much less. But again, improved body composition. So most women notice that they're able to, again, have more muscle strength, more muscle mass, and then they're able to be stronger and more lean muscle mass, so less body fat. Again, improved energy and well-being. It does have a slight antidepressant effect. It does affect the neurotransmitters in the brain. Again, bone density. So osteoporosis is very common as we age. So improving bone density. And my teacher, Dr. Rouzier, talks about, for osteoporosis is, full court press, he says, estrogen, progesterone, testosterone, DHEA. We want to give all those hormones because those are what really regulates your bone density health. It's not all about calcium. Yes, there is calcium, but the hormones regulate the metabolism. So improved strength and endurance also helps with sexual function for women. It will enhance clitoral sensitivity and orgasm. You can apply the cream. We're always applying a cream, and the cream can go topically right on that area, right at the clitoral area. It can be very helpful. Another thing that can be really helpful for testosterone when it's applied vaginally is sometimes women have frequent UTIs. And so if you apply this, it helps the urethra become a little bit more toned, so it reduces the urinary tract infections. And then, of course, it helps your skin. So we want improved skin texture. It prevents the skin from sagging. So I think that's always a good thing. So again, the beneficial effects for men, loss of fat, bone density, does protect against osteoporosis. One of my neighbors years ago, he has he had osteoporotic fractures. And, of course, they put him on Fosamax, which, is good. But I think taking this type of approach is a lot better because it is healthier and you're not on a toxic drug that doesn't actually improve your bone strength. It just prevents the fractures. But improve mood and sense of well-being. And that's a big one for men. When their testosterone gets low, they don't feel as well mentally. They may be more irritable, things like that. And so they tend to be happier. Again, mental sharpness, sexual function, and greater strength. And so what we look at is, from a lab testing standpoint, I love this thing, like normal isn't optimal. So the normal testosterone can range anywhere from 350 to 950 or 1,000, depending on your age. It can go up to 1,200 for the younger men. However, if you go to standard medical care, if your level is at 400, they'll say, oh yeah, your testosterone is normal. There's nothing we can do, even though you may have symptoms. Now, where is the optimal range of testosterone? For men, I think it's more, above 700 typically is where most men feel better. For women, I look up to like 100, although some women will put their levels at 300. And I met one woman, her level was at 1,000, which I thought was a little bit much, but it is safe to take. But I don't believe it needs to go that high. So we just want to make sure that we test you and see what your levels are. And then if you were to take supplementation, monitor the levels there. And again, the hormones do go down with age, and they have increased effect on the diseases of aging, which is heart disease, dementia, weight gain. And my goal is always to help you feel better with the safest and most effective treatments to help you function and metabolize better. And the safety is often a concern. So I had one of my patients say, oh no, my father, so it was a man patient, and he had low T. He goes, oh no, I won't take testosterone because my father and my brother had prostate cancer. And I said, well, did your father and brother take testosterone? He said, no. I said, well, the newest research suggests that testosterone can actually help prevent prostate cancer, and it definitely doesn't cause prostate cancer. So when I first started in this field, 22 years ago, they thought that testosterone was a factor in prostate cancer. The newest research, the last 20 years show there is no correlation between testosterone and prostate cancer. So that's good news. And that they found actually that those men that took testosterone and got prostate cancer, because we would never say, oh, you won't get prostate cancer. That's not.
What?
But if you were to get prostate cancer and while taking testosterone, the outcomes are usually better. So you'll probably survive, have an easier time. And then other concerns might be blood clots. And so when you take testosterone, it can increase some blood factors, what's called hematocrit and hemoglobin, but it doesn't increase all your blood cells. So the research also shows that it does not cause blood clots. And so there's a condition called, I always say thrombocytopenia, but it's actually the opposite, where you have too many blood cells. And so when your blood cells are high, then that can cause, certain conditions can cause blood clots, but the testosterone only increases a couple of these numbers, and it doesn't. And I also monitor them to make sure that they're, I'm okay if they're a teensy bit high, but I don't let them go way too high. So I feel that it's very safe. And then none of these, for testosterone for women, very safe. It can cause some acne. So when I first started taking testosterone, I would get a lot of acne. However, I think that was due to my higher insulin levels at the time. And so once I got that taken care of, that really isn't a factor anymore for me. And then sometimes people might notice a little extra hair growth on their face. And I had a patient yesterday, she felt that the hair on her arms were a little bit more. You know, to me, that's not the worst side effect ever. So I think it's pretty safe in regards to that. So prostate cancer, blood clots, and really that's it. I think I, you know, got most of the information on testosterone, and really wanted to just open it up for questions now. Let's see here. Let's see if anyone has any questions in regards to this. Stop the